She's a trainer. She's a trainer for the soft skills in Uganda, and she has led the transformation in the skilling of young nurses and midwives, and also changing the attitude, transforming the general nursing skills into entrepreneurship skills and the general practice in Uganda. So just 2 minutes. I'm giving it 2 minutes so that you can invite your friends, and then we shall begin. Once again, I welcome you to this Busoga Health Forum. Thank you. Hello, dear friends. For those who have just joined us, you are most welcome. And of course, we are talking about soft skills in healthcare service delivery. What could be the soft skills? And of course, in my mind, I was running, thinking about what are the hard skills in the other perspective. Because if we talk about soft skills, that means generally the public has hard skills. Yes. Now, of course, if you have any question, any comment, or opinion, or any suggestion, you can drop it in the chat box so that you are helped and attended to at the fastest and easiest time. And of course, you can go ahead and introduce yourself in the chat box of where you work from, your name, your email, and your telephone number so that we can work together as a team. And at this point, I want to welcome a representative from the Busoga Health Forum to quickly give us an overview before I invite our guest to speak on board. Mr. Desmond, could you be around? Of course, yes. Thank you so much. We have a general meeting on 30th of March this very year. And of course, we shall be gathering at Civil Service College, Jinja. For members and all non-members, please come on board and subscribe so that you can be part of the Busoga Health Forum. You know, we have a theme that says a thriving Busoga, a healthy, thriving Busoga. So I want to welcome you on 30th of March 2024 to come and be part of our annual general meeting that takes place at the Civil Service College. You can come and subscribe for non-members. And for the members, we encourage you to come and renew your subscription so that you're part of us. Now, at this point, yes, please.
Thank you so much, Daniel. I just want to be quick at this, and we dive into this interesting session where our own Winnie will be discussing us the soft skills. You've just mentioned all what I wanted to say. I just want to welcome members, but just a brief overview about BHF. We are a not-for-profit organization, and we are here in the heart of Busoga in Jinja City. That's where we're based to do all our activities we are doing in the whole country. And our vision is to see a health and thriving Busoga, and we encourage everyone who is part of this call that kindly come and join the efforts. You can be a volunteer. You can also extend your support anywhere you are. And we want to achieve this through that vision you're seeing. We are hiring all professions. And by saying professions, we are looking at a multi-sectorial approach. We welcome everyone. We welcome the teachers, we welcome the lawyers, we welcome the farmers, we welcome everyone that you can please come and be part of us, because we understand health is just not looking at the deformities of an individual or sickness, but even it is so broad, looking at the economical and even the social and the political things that we need to improve to have our health that will continue working very well. And if you look at our core values, they're just on your screen. We are so transparent. We are looking at adding value in everything we are doing. We are collaborating with every partner who is coming in the region. We are impact focused. That's why we are doing a lot of research in the region. And we want to make sure that everything we're doing is effective and also prioritize efficiency. And those are some of the core program areas that we are working in. We are having interventions in RAMNAC, that's reproductive, maternal, newborn, child, and adolescent health. We are having very many interventions that are looking at malaria, HIV, and TB. And of recent, our patron and advisor, Dr. Speciosa Kaziwe, came out and said she wants to champion malaria, and she's doing a lot of interventions with them. So get the from, so but you can come and also join the initiative and work together. We are having a lot of activities in infectious, but also in the communicable diseases and urban health projects that we are doing in the region. Kindly contact BHF using through that website, and such presentations like Win is going to, Lydian is going, Win is going to present today are going to be uploaded on the website, and you can download and even continue reading. Our Twitter is so resourceful and always updated. You can always follow us, tweet with us, and also message us. The same thing, if you miss out any part of today's session, kindly feel free to go to our YouTube channel. There you can read, you can review it. If you missed a point, kindly you can even listen to it in your own time. Be a member of BHF, kindly register with BHF to support such activities. We have to pay for Zoom to continue having our fellow people learn with us. So you can be a member of BHF by paying only 100,000 shillings per year. And institutions, we can also work together. You pay 500 shillings and you work together. Then you can become a lifetime member, not being stressed every year to pay 1 million shillings as a lifetime member of BHF. We kindly invite you for our AGM lastly, which is on 30th of this month, where we are going to discuss with our members and hear from you and request membership and become a member and join us, but also come and network with the members of BHF. Thank you so much, Daniel, over to you. Yes, Daniel, you're mute.
Thank you so much, Mr. Desmond, for reminding us of who Busoga Health Forum is and your vision, your mission. Just like I often invite people to come on board and attend this annual general meeting, there is more to know and more to learn about this. Wow, Mr. Desmond can't attend the question. Is the attendance free or it's co-paid? In the chat box. Meanwhile, let me take this pleasure to invite our one and only, our self-motivated person, the one who can give knowledge for free, the one who has been all over social media, the one who loves nurses, the one who wants nurses and midwives in the country to thrive amidst their small income, salaries, and a lot of expenditure. And that's none other than Miss Winnie Nabukera, the CEO for the Little Win Foundation and the principal Nurses and Midwives Mentorship and Coaching Program, the Nursepreneur, Health Coach, Speaker Mentor, and Soft Skills Trainer. Madam Winnie Nabukera, CEO, please come on board and introduce yourself better before I invite you for a discussion.
Amazing. Thank you very much, Kamara and the team. I'm so humbled. I'm so happy I'm meeting all of you. I know we are going to have such a great time of learning together. My name is Winnie Nabukera. I'm a nurse sonographer by profession, and it is really an honor meeting you virtually, getting to know you as we discuss about soft skills training. Thank you.
Thank you so much, CEO for the Little Winnie Foundation. Take the pressure, and we are happy that we've seen your face. In the long run, I shall also put on my camera so that people can see how handsome I look, right? So without wasting time, let's dive into the presentation and know what soft skills are. I'm just encouraging members to do the chat box so that we can interact more, knowing what soft skills are. What is your experience as the presentation goes on? Please feel free to use the chat box for your questions, for your opinions, for your expertise. People have been in field for 10 years, 8 years, 15 years. That means the perception, the experience, and the attitude maybe of nurses and midwives and other healthcare professionals in the field may be beneficial to us when you share your experience in the chat box. Please go on and interact with us here at the Busoga Health Forum Zoom conference. Madam Winabukera, please go on with the presentation.
All right. Thank you very much, Kamara and the team once again. I must say that I'm so happy meeting all of you and discussing about a topic that I'm really so intentional about and a topic that I deeply love at heart. I know Kamara a little bit talked about who I am and what I do, but just for clarity, Little Win Foundation is a social enterprise that provides integrated health rights education in HIV and sexual and reproductive health among youths and adolescents in schools. However, we also run different mentorship and coaching programs purposefully for nurses and midwives to be able to redefine their professional purpose, get to know who they are, get equipped with entrepreneurship skills, soft skills, work on their attitude and mindset so that they can be able to live better lives. We also run different capacity building trainings, soft skills trainings, corporate trainings for organizations in areas of leadership and management, customer care, stress management, team buildings, and so much of that. And then also lastly, we do run professional caregiving courses. That is for people that are passionate about care, and you want to be able to take care of the elderly, the sick, and those that are vulnerable. So I'm really so humbled, as I said, speaking about something that I deeply love on heart, and I know we are going to definitely have a great time. So if you can be able to see me, that is my beautiful face together with my picture here, and these are my contacts. So let's be able to dive into the presentation. Kamara, let me know. Are members able to hear me? We can be able to move ahead.
Yes, please, you are very audible, you are visual, and what can I say? We can be able to see you, we are able to hear from you, we're able to see the presentation. Everything is at par with the Busoga Health Forum.
All right. Thank you very much, Kamara. I love interactive sessions, even when I'm virtual, and I want to see you guys very busy in the chat room, giving me feedback, discussing together, because I'm also here to learn from you. I can say that someone could be there and they're watching me or they're hearing me speak and they're wondering, why are we actually talking about soft skills training in healthcare? So I want all of you to be able to, let me see, we are 49. All of us, we are going to go to the chat and we are going to give in our thoughts, our feelings about what we think about soft skills training in healthcare. Just go to the chat. I want to see people in the chat. Is it, are members able to chat in the chat box?
Yes,
Please
the
go
chat
to
box
the
is
chat.
open.
All right. Please go to the chat. Let me know, what are you feeling? What do you think about soft skills? Why do you think it is a topic that we should be able to discuss to you this very evening? Let me see some people in the chat giving in their feedback. And as I go ahead, I'm going to be reading most of your comments because I said I love active participations and I love to hear what my audience has to actually say. So please go to the chat. Go to the chat. I can see Alan says soft skills training is about earning extra pay outside the salary that is never on time. Wow. All right. Let me see other people come to the chat. Please go to the chat. I love interactive sessions. I love to engage my audience because we learn from each other. Dennis says soft skills make work much more easier and enjoyable to do so. Wow, this is amazing. And then someone says, I have personally not heard about soft skills. I'm eager to learn. I'm a medical student in 4th year. Wow, kudos to you. And I know by the end of the training, you're going to be well conversant with soft skills. All right, let me see other people in the chat. Let me see people in the chat go on to be able to giving their thoughts, their feelings about soft skills. And this is a very open discussion. No one is watching you. No one is going to say, hey, you've not even heard about soft skills for the whole of your life and all of that. No, just feel free. So I'm going to move forward as I'll also be reading in your comments, and then we can be able to learn together. So these are the different objectives that we are going to be following in the discussion. So number one, we are going to be able to define soft skills in healthcare. So my friend that said you have no clarity about soft skills, the objective number one is going to sort you. And then we are also going to look at soft skills versus hard skills, okay? And then we're also going to look at soft skills relevance in healthcare. Then also talk about top soft skills needed in healthcare. And then also how to develop soft skills, okay? And then also becoming a health coach, a mentor, a soft skills trainer, and also an entrepreneur. Oh my God, all these things actually make up life for me because I feel all of you should actually be coaches, should be mentors, should be speakers. And by the way, you should be entrepreneurs as well. So let's move forward. I want to see more other people in the chat. Please. Andrew says not heard about them, but I think it's to do with how you interact with patients in healthcare. This is amazing. And then my other friend here says soft skills may enable me to perform other activities, rather technical work. Great submissions, great submission. No answer here is wrong or right. Please be able to go into the chat and then we can know what you think about. All right, let's dive into the session. I hope you're excited. You have your notebook, you have your paper, and you're willing to actually be able to take notes and learn and enrich your knowledge this great evening. So let's dive into the session. Soft skills are a combination of people or social skills, common skills, essential skills, core skills, interpersonal, communication, emotional intelligence, and personal traits that make it easy to get along and work harmoniously with other people. Let me repeat it once more for you so that it sticks into your mind. Soft skills is a combination of people or social skills, common skills or essential skills, core skills, interpersonal skills, communication, emotional intelligence, and personal traits that make it easy to get along and work harmoniously with other people. I know so many times soft skills have always been underrated, but I'm telling you for sure, according to research, actually 85% of a job success
the presentation is
actually related to, yes? Someone is saying something?
Kindly, friends, I invite you to be to listen carefully. The network is very stable and we are able to hear her very well. So if you are not able, kindly stabilize your internet connection and you pay attention because we are against time.
All right, thank you very much, Kamara, for that. I was saying that so many times soft skills are underrated, but I'll tell you for sure, according to research that has been ongoing on, 55% of job success is actually contributed to by soft skills. And by the way, only 15% is only contributed to hard skills. And I know we are going to dive more into the hard skills and we'll be able to have a difference between having hard skills and also having soft skills. And I know in our trainings, it is so much of theory, so much of practical knowledge, research, and all of that. But then these small core skills that actually make us to be able to relate with one another, be able to have emotional intelligence, common skills, are by the way never actually taught in school. And realize when you come at workplace, these are simple things that actually are able to make you go through the workplace harmoniously and be able to interact very well. Let's say, for example, you're working in a hospital, in healthcare, or even outside healthcare, because also still soft skills cuts across. Not only soft skills are not only needed in healthcare, but also even other fields or of workplace. So let's move forward. Let's now talk about soft skills versus hard skills. I know some of you have heard about hard skills, like, you know what, Winnie, I did my degree, I have my certificates in these qualifications and all of that. We are going to be able to understand. So hard skills are talents and abilities that can be quantified, are measured, and can be listed in a resume, okay? They can be quantified, measured, and they can actually be listed in a resume. And they can be taught and usually job specific and form the backbone of all positions. Let's say, for example, right now, a given hospital puts up an advert that maybe we need a medical doctor, we need a professional nurse or midwife with such specifications. And we are going to be able to look at those different specifications so that you know that actually these are hard skills that they usually are looking for. So some of the examples of hard skills, we have computer skills. Your ability to use a computer to be able to do the work that you do. And as you know, because the world is now changing, most of our work is digital. You're able to use the computer, insert data, store patient's data and all that into the computer. So that is a hard skill, okay? And then number two, writing skills. If you're a good writer, you can be able to write books, you can be able to write your patient's records or even notes and all that. That's also a hard skill. I know you've also heard about phlebotomy. Phlebotomy skills, your ability to be able to, put on withdraw blood, put on cannulas and all of that. That is also a hard skill. And then also marketing skills. For example, you're a doctor, you're a nurse, and you have maybe persuasive skills. You're able to sell so that people can be able to buy. That is also a hard skill. But also reading. Reading medical charts, reading books and all that, that's also a hard skill. And then also math or calculations, administering medication. Did you know that actually administering medication is a hard skill, okay? And we are going to later on appreciate that even when you administer medication, yet you don't have empathy, you're going to lose out because people are going to complain about you because you only think, after all, I studied, I have my degree, I have my qualifications. And then later on, we're also going to appreciate that, by the way, hard skills will be able to get you into employment or they'll be able to hire you. But then soft skills are the ones that are going to help you get promoted or even get into the workplace and work harmoniously with other people. And we have to know that this can be acquired through classroom, online course books, and also materials. So if you've studied, you have your degree, you have your different qualifications that you've had, those are hard skills. All right. So let's now ponder more about the soft skills because this is a very core sector that we have to be able to appreciate on the moving forward if we are actually to improve our quality of care into our different hospitals. So these are traits that make you a good employee and getting along with others at workplace. Soft skills, these are traits that make you a good employee and getting along with others at workplace. I know so many times our workplaces, it can be crazy. I mean, so many stuff happening, patients calling us, our bosses calling us, and I mean, so many crazy things are moving up and down and all that. But then if you don't have soft skills in your pocket, you're going to realize that you're going to have a lot of stress. You're going to get a lot of burnout. Why? Because you don't have a balance, okay? You don't have a balance of your hard skills and also your soft skills, and that is why you don't have stability, for example, in your performance, okay? And so much of that. So let's now look at the different soft skills that are needed into healthcare. Number one, communication skills. Communication skills. You know, so many times our work is about speaking. Our work is about effective communication. How you're able to communicate to your patients, how you're able to communicate to your colleagues, how you're able to communicate to your bosses. So realize it is more about sending and receiving of information back. And realize if you don't have actually effective communication skills, so many times people are going to say, that person is very rude, she's very tough. And for you, you think it is very normal. You're just communicating in a normal way. But then maybe you don't actually even observe your body language or even other people's body language, eye contact, okay? But then also the non-verbal cues. Sometimes someone can approach you and, for example, they're asking you something, and then you don't reply. But the mere you rolling your eyes and, for example, just turning them down already communicates that this person is not interested. For example, a patient comes to you and they're like, hey, Winnie, please, can you please come and help me here? And then you've not responded anything, but then you're already telling them, I'm tired, please go away. So that is already a nonverbal cue that is actually communicating to them that I'm not concerned about your pain, by the way. I'm not worried of whatever that is happening. And by the way, leave me to chillax here. Okay. So that is already a skill that you have already missed because you cannot be able to, control, maybe even be able to work on, observe your body language, work on your eye contact, on your non-verbal cue, or whatever that you can actually be able to speak out. So that is already a skill that is needed in healthcare. And then as well, leadership. Leadership, you know, leaders inspire people, empower people, have shared vision, and also lead change and ABCD. I know so many times we can think, after all, I'm not the boss, I'm not the manager, I'm not the in charge, and therefore I'm not a leader. But I'm here to tell you that all of you in your different spaces of work, you are leaders, whether by appointment, whether by what, you are a leader. Because if you are a nurse, midwife, or a doctor, or whoever is listening into me, and you're self-driven, realize you actually have all these skills in place. Why? Because you know it from your heart that I'm a leader. I must be able to inspire change. I must be able to lead, empower people, and then be able to achieve goals and visions of my organization. But also remember, as you do all this, you're achieving your personal and also your professional goals. So we've already talked about communication, where you're able to ask questions, listen intently, and respond effectively. That means you should be able to work on your verbal and non-verbal communication. I already explained this. And also leadership, I've talked about it, being able to lead people from point A to point B. Know that you're a leader at all levels. No one should actually, make you think otherwise. For example, maybe you're not an appointment. Just have it in your heart that you're a leader, and therefore you must have to drive yourself every day to perform. And then also we have interpersonal skills. These are people skills: listening well to others, having a positive attitude, communicate effectively and respectfully, not to hurt others. Interpersonal skills. This is something that you can feel even in your heart. How is your attitude, by the way? Because you know a bad attitude is actually like a flat tire. You must have to repair it before you can actually move any further. So how is your attitude? How are you able to speak with respect so that the other person around you doesn't feel hurt or doesn't actually feel dishonored, not respected, and ABCD? So interpersonal skills. How many times do you speak when you want people to actually listen to you and you never actually want to, them hear you, you never actually give them time so that you can also appreciate what they're speaking to you. So interpersonal skills. And then work ethics and motivation. Work ethics and motivation. A strong work ethic and strong drive as to why you do work by being responsible, taking self-initiative, meeting deadlines, commitment, and showing up. Showing up. work ethics and motivation. I know so many times in our different workplaces, we are always saying we are not motivated, we are not happy, people don't appreciate us, A, B, C, D, A, B, C, D. But then realize motivation starts with you. If you're not able to appreciate yourself, even when someone comes and give you maybe a paycheck of how many dollars or whatever monies, and you don't respect and be able to appreciate the work that you do, you'll not get that fulfillment. So I want the 89 of you that are listening in to me, have motivation, have self-motivation, because no one will actually ever motivate you, but you can always motivate yourself amidst the different challenges that actually come by our different workplaces. And then as well, we have teamwork. Teamwork is the ability to collaborate and cooperate with other team members and stakeholders. This is something that is very crucial because so many times our work is about teamwork. You realize you may get a challenging patient and you need to call in your colleague to step in, to guide you and all of that. And you realize if you're able to have a collaborative effort, you'll be able to achieve goals and you'll be able to, satisfy patients' needs because you not only think alone, but then you're also involving other people to be able to support you as you support your patients. And then as well, we have problem solving, a very great skill, finding a way of moving forward. Always, it involves creativity, innovation, logical reasoning, and informed decisions. I know for sure our work sometimes gets crazy. I mean, it's a lot of issues coming in, patient telling you this, your boss telling you this. It's really complexity, okay? So your ability to be able to think through very fast, okay, will be able to save you. And that is already a soft skills that you actually must have to embed it into your hard skills because yes, you can know how to probably curate. But then if you don't actually have that soft skill of empathy, sympathy, that soothing skill, definitely someone will say, but the other Msao, when she puts on me the cannula, there is a way it doesn't feel. I mean, there is a way it doesn't pain. But when this one comes, I feel I even want to overdo what? So that is already a difference in how you're able to solve, how you're able to handle, but how you're able to even satisfy the needs of your clients. And then we have flexibility and adaptability, being open-minded, being open to change, find new ways to doing things while being self-aware, be open and have a teachable heart. Flexibility and adaptability. I know so many times, as I said, I keep saying our work is very crazy because, I mean, it's very uncertain. Today you're working here, tomorrow they are taking you to a different workplace. Today you're managing patients with different conditions, and tomorrow they're actually coming in patients with different conditions, A, B, C, D. So you must have to be flexible, okay? Don't be too rigid. And I know for sure, I love to also talk about having teachable hearts. Your ability to learn every day is going to take you further because you realize most of the skills are not actually taught in schools. So if you have a teachable heart to even understand that, oh, I think I've not heard about soft skills for all this longest period of time. Let me go and do a course in soft skills training so that I understand myself more and then I can be able to achieve my personal and also my professional growth and development. And then also conflict management, a very great skill that is needed in healthcare. Your ability to not only cause conflicts, but have a win-lose philosophy. Don't cause drama. Don't be associated with conflict. Conflict management. Are you the kind of a person that when you see conflict, you're like, yeah, please move on, eh? Which means you're lacking a soft skill because if you have these conflict management soft skills, you don't want to associate yourself with drama. You don't want to go into strike because, I mean, after all, there are some things that you can be able to control and then those that actually you're not able to control. So just have a win-lose situation. I mean, a win-lose philosophy. Sometimes it is okay for you to say, I'll leave her. Not because you are a fool, but just because you don't want to associate yourself with conflict. And that is a soft skill. And then other soft skills can be empathy and sympathy. You know, this is a very great one when it comes you being able to, see yourself into that patient's, chair or even bed and all of that, and be able to perform accordingly. Because I know for sure so many times we underrate and look at people and we're like, after all, she's not my mother. After all, I don't know them, so I'll do whatever that I want. But just imagine if maybe it is your mother, if maybe it is your child, someone that you actually really care about, how would you want that other person to be able to take care of them? So it is very important for us to have empathy and sympathy right from our hearts. And then also self-confidence. Self-confidence is also another skill that we must have to be able to learn. How are you able to express your needs respectfully? How are you able to show up? How is your dress code, by the way? How is your body movement, by the way? That all actually speaks to self-confidence. And then as well, positive attitude, looking at things in a positive light. This is actually a core skill, because the moment your mind is actually shattered with a negative attitude, you're going to achieve less. But if you have this flexible mind, this positive attitude, you're going to move so many places because you're a go-getter. You are a winner. You're someone that encourages yourself every day, and that can actually be realized into your goals because you have a positive mind. As others are thinking the salary is very low, so many crazy things are happening for you, looking around because you have a soft skill of being a problem solver. You're looking at how can I maximize my income? How can I think outside the box? How can I support my patients more? How can I be innovative and creative? And so much of that. And all that will actually take you if you have a positive attitude. But also time management, very great skill. You know, time is money. And you know, in healthcare, if you're able to miss out on time, maybe someone's life is actually at danger. So time management, emotional intelligence, and also being assertive. Being assertive, knowing what you want and being able to go for it. Because guess what? If you don't actually show up, no one is going to show up for you. So the 97 of us on the call, being assertive is a very great skill that we should actually be able to cultivate from today, because no one will speak up for you. You have to speak up for yourself. You have to stay confident and be able to show up in power, and then you can be able to achieve your goals and dreams. All right, let me check in. Let me have some feedback. Let me see some feedback in the chat. How are you guys feeling? How are you feeling? How are you feeling? How are you feeling? Please let me see people in the chat. Please go in the chat. Tell me, how are you feeling? Are you learning something? Is your mind getting open? Let me know before I continue. Someone says, thanks for the initiative. Yes, my dear. Let me have some feedback. You know, I said I love interactive discussions even when I'm virtual because I need to feel the vibe. Let me see. How are we feeling? How is it going? Paya says, amazing, Winnie. Ida says, bravo, Coach Winnie. Wow. Let me have some feedback. Let me have some flowers. Please send me some flowers, some wine. Let me see some hearts in the chat if you guys are able to follow. I want to see the 97 of all of you, because I don't want to just have a few and I'm losing out on all of you. I need to see you, okay? Personally, I'm enjoying. Beautiful, good to hear that. Very educative and interactive session, Winnie. Amazing, great presentation, amazing. Please send in flowers. Please send in flowers. Please send in flowers. I need to see everyone active. I don't want to see anyone dozing on my call. All right. So as you guys keep sending in your flowers and your messages, let's go. What is the relevance of soft skills in healthcare? Because I know we've talked about the different soft skills, the hard skills and all of that, but then we need to understand, is it something of relevance that we actually be able to talk about? So here it says, research has found out that the use of soft skills make a productive, happy staff and a satisfied patient in this demanding profession. I'll tell you for sure, if you're able to practice all this as you go back to your wards, your different workplaces, you're going to see a lot of difference. If you're able to put a difference of your hard skills, okay, be able to calm down at a level that you can't also explain and be able to just allow your soft skills drive you, I'll tell you for sure, you give me a call. You give me a call and you're like, Winnie, I didn't know what I was doing because I thought having my degree was enough. But then I realized being calm, okay, being patient, being empathetic, knowing how to communicate, being a better leader, being a person that can be able to motivate myself has actually enlightened me, and I'm able to perform optimally great. So developing hard and soft skills, we hope nurses perform well in their careers and coping with fast-paced medical settings. We must have to appreciate that so many things in healthcare have changed. Gone are the days of maybe the 90s. I mean, things have really changed, ultimately great. So if you are this rigid nurse that is not flexible, that is not adaptive, and you feel the settings of 1990 are the settings that are actually performing right now, then you're going to find a lot of issues. Okay, so that is actually it actually explains you being able to be flexible, you being able to be adaptive. How are you able to cope with the different changes? If they tell you that gone are the days where maybe data is written in books, stored in store and all of that, and right now we are using electronics to be able to store data and information and all of that. So if you're not flexible to learn all these skills, you're going to cry because you'll not be hired. You're going to lag people behind. Why? You are missing some skills, okay? And then improve communication and relationship to the patients. This is very important. And I explained this as I was talking to you about how effective communication help us to be able to satisfy our patients' needs. And then also improve patient satisfaction. This is so important. I know for sure in our hospitals, it is usually customer care, poor leadership, people have a poor attitude and all of that. But if we are able to put our soft skills in pocket, I'll tell you for sure, 100%, patient satisfaction will be a goal achieved because everyone is willing to work. You, of course, know the nitty-gritties of the work that you are doing, but also more definitely, you know things that you can control and even those that you cannot actually be able to control. But above all, when I was beginning my journey of self-improvement and also learning about soft skills, I realized life is for you. You have to set your goals. You have to know what you want. No one should actually be able to understand, to make you think through and all of that. You must have to be able to understand your journey and plan accordingly. The jobs that you're actually working for, they're just enabling you to get to your another height. Okay, so don't be into a job and you feel you're going to be there 100% of all your years and all that. So be able to set your goals, know who you are and where you want to go, and then you'll be able to even satisfy your patients because you've understood the journey that you're actually trekking. And then also listening attentively, very important. You being a listener, being able to understand others before you seek to actually be understood. And then also showing empathy and sympathy to patients and colleagues. This is something that is very important, and I already explained it, being able to feel for what the other person is going through, and then you're able to show up and support them accordingly. But then as well, appreciating patients' values and also preferences. This is very important because we work with patients who have different values, different cultures, backgrounds, and ABCD. So if you have soft skills and someone tells you that maybe in our culture, we don't do ABCD, definitely you'll not be able to do it unless, versus if maybe you think what I know is what I have to do, okay? But if you have, of course, soft skills, you'll be flexible and you can be able to understand the different values and preferences, and then you can be able to support your patients accordingly. All right, all right, all right. Let's go back. How do you feel so far? How do you feel so far? Let me still go back to the chat. I told you as a teacher, a mentor, I love to see people interactive. Let me see what you have to say. How do you feel? How do you feel? Let me have some images. I'm not seeing people in that chat. What is happening? What is happening? What is happening? Sam, I don't know what you're sending. Oh yes, Edika Musinguzi, good to have you. How do we feel? How do we feel? Are we learning something? Are we learning something? Innocent says it's a wow. Wow. All right. Let me see people in the chat. I don't want to see anyone dozing here. Wonderful presentation, enjoying flowers. Wow, this is amazing. Oh, Aisha says, I feel I'm a changed midwife now. That's amazing. Winnie says learning, nice presentation, will be promoted soon. Definitely. Definitely you will if you're able to put your soft skills in pocket. Because I told you, hard skills will get you hired. But then soft skills will get you promoted. Okay? All right. Dick says, so interesting. Wow. Wow. I want to see more people in that chat because I need to know that people are following, you're seeing me, and you're learning, because after this session, Busoga Health Forum expects you to go and present, expects you to go and be better nurses and midwives, better health professionals, so that you can be able to make it thriving, so that you can be able to thrive and achieve your personal and also your professional goals. Andrew says, wow, I don't understand that. But Linda also says, it's been a nice one. Thanks, Winnie. Amazing. Amazing. Let me go back to my presentation because now you're following and I know that I have you. All right, let's now go to something different. Let me put on another slide. All right, all right. So let's now ponder more about becoming a health coach, a soft skills trainer, a mentor, and also an entrepreneur. This is where I want to share part of my journey. I know, as Kamara told you, I'm a nurse sonographer, but I'm also a CEO of my own personal initiative, and that is Little Win Foundation. I love to inspire people, especially nurses and midwives, to be innovative and creative, to stop complaining, to stop lamenting, and be able to use their skills, their knowledge, so that they can be who they want to be and they can always impact their communities. I know in our trainings, it's like a kind of a training where they give you knowledge and skills, and then after tomorrow, they tell you go and search for a job, go and apply for a job, go and seek employment and all of that. And me as an entrepreneur, I believe all of you, the 109 of you, you have capability for you to perform good at your job, but then also be able to use your other skills, your other abilities, your other talents, so that you're able to be happier than ever. Just imagine being a nurse, you're an entrepreneur, you're an influencer, you're able to do what you want to do, and you're happy at the end of the day. Because I'll tell you for sure, life is about choice. You make a choice to be miserable, you will. But you make a choice to be better, definitely, you will. And actually, I don't know what is happening, but so many times we feel that maybe in healthcare, it's not a lot of success, not a lot of people achieving amazing success and all of that. But just think through of people that have come and hit a lot of money in that profession. So I want the 109 of you to have a different and a changed mindset from today, that you can make it. You can make it regardless of background, regardless of level of education. As long as you have a positive attitude, you have your intention to seeking mentorship and coaching and guidance, definitely you can make it. So I know Kamara talked about that we have a nurses and midwives mentorship and coaching program that inspires nurses to be better, to redefine their professional purpose, get equipped with entrepreneurship skills, work on their work-life choices and all of that. So that is a program that you can be able to join up. Okay. And then we also have CEO World Changer programs that supports people that want to be entrepreneurs. You have an idea, you want to start up an organization, you want to impact your community, you have this burning desire in you. You can be supported to be an entrepreneur and do something on your choice, on your own, that you love, and you thrive at the end of the day. And definitely there are so many different that you get, being able to understand who you are, getting nurtured with a positive attitude. By the way, joining a network of people that think like you, because you know the world is so crazy. So many people talking a lot of crazy things. So you need to be able to be intentional about your environment, because it also supports your personal growth and development. All right, so that was just a by the way to understand why I'm doing whatever that I'm doing and the different programs that we run. But now let's go back. Let's now have a question and answer, because I believe I've spoken a lot and I want to hear from you. We are going to be able to open up your mic so that you can be able to speak to us, and then we can keep the conversation ongoing. So I think, Kedi, you can be able to take us through the question and answer session, and then people can be able to ask in their questions. Thank you.
Thank you so much, CEO, Little Winnie Foundation. We want to thank your expertise and for coming through and all this knowledge that you've shared to us. Now, dear friends, we are just a few minutes time, but I encourage you, if you want to speak, you can use the chat box and we shall be reading your question and the CEO will be getting back to you. Just hey, hello Desmond, we need a CPD link, please. We can't attend this and we miss on the CPD points. I personally want. There is a question. It was from Amuza. The question was, how do we differentiate? What is the question? It was like the first question actually. Okay. How do you differentiate qualities of a good worker from the soft skills? That was our first question. Kindly, you can answer this as people get to us with more questions. Also, you can see Desmond, please come to the chat box and attend to the question. How do I join the Busoga Health Forum?
Okay, thank you so much, Daniel. Busoga Health Forum is an open organization. I'm sharing my number for everyone who wants to join the Busoga Health Forum. You can inbox me. We can continue the talk in the inbox. Kindly receive my WhatsApp number, and then you can inbox me and we'll discuss. Then I'm sharing the CPD link, and I'm kind of requesting, we are 106 people online. Let us all register kindly on the link I'm going to share. We are 106 and I register. I request we all register.
Thank you so much, Desmond. Hello, CEO. Question number 2, what is the cost of mentoring in terms of entrepreneurship? Question 3, what are the areas that a nurse or midwife can practice privately as an entrepreneur? Kindly tackle those questions. Later, we can get back the chat. Hello, Winnie, able to hear me?
All right, thank you very much, Kedi, for that. I'll go to the last question that you asked. That was, what are the 3 areas that a nurse can be able to practice as an entrepreneur? Was it like that?
Yes.
All right. So our mode of training depends on your capabilities and also your passion. Whatever passion that you have, whatever capability, talent, or skill that you have is what we actually tailor on the training for you, so that you can be able to do something that you passionately love. But then as well, it must have to be into a business format or a problem that you're going to be solving, and then we can be able to tailor our training for you. And then differently, because you're solving a problem, you're an entrepreneur. So that is how we do it. I may not be able to dictate and say that probably you can go and do ABCD or start up a community project or do a drug shop or whatever that you want, but it depends on what are you passionate about? What are your skills? What are your talents? What change and impact do you want to make to your community? And then we can be able to tailor training that fits your needs. And then as well, what is the cost of mentoring? Mentorship goes for 450,000. That is 8 weeks. It is virtual, everything virtual, and then you can be able to get your certificate as you graduate after the 8 weeks. And then also the first question, Kamara, was not clear. Someone saying, what is the difference between a good employee and something like that? I didn't get it right.
Okay, thank you so much. Let me just recap the question. What's the difference between qualities of a good health worker and the soft skills? Mm-hmm.
All right. Thank you for that. I feel qualities of a good nurse or a good employee is none other than you being a full package of soft skills. If you're able, because qualities of a good employee, time management, motivation, leadership, communication, all of that. I mean, being conflict management skills, problem solving management skills, critical thinking. And when you look at soft skills, these are actually things that we have been able to discuss about this very evening. And I want to encourage all of us, if you want to be better, you want to be promoted, you want to be good and better and great at what you do, just have a pocket of all these soft skills. And I told you, you can be able to be intentional to learning about them so that you develop empathy, sympathy, I mean, be a problem solver and all of that. And you can definitely be as good as a good employee or even a good boss and all of that. I hope it's clear.
It's very clear. Let's look into more two questions so that we can have this discussion close at the exact time. Friends, the link is already in the chat box. Kindly use it so that you can benefit from the CPD points. And also, I guess we have no question, but I can allow 3 arms, each taking 30 seconds, so that we can hear from the public. Hello, friends. If you have any question that would love to speak, kindly put up your hand, and then we can.
Maybe, Kedi, those that are not able to speak, please share your feedback into the chat. What has been your take home? What has been your take home? What have you learned? What are you going to be able to change? Have you been inspired? Are you motivated to perform better? Let's know into the chat. And those that are able to give in feedback as well, you can be able to open up the mic and give in feedback as well.
Okay, meanwhile, there is another suggestion, the chat box. Please, people, register. The link is just here. Just tap into and to direct you where to go. And also, the presentation will be found at the website of the Busoga Health Forum. Yes. Hello, friends. Could there be anyone trying to speak? Okay, if there is no one to speak, I encourage you to go to the chat box to use it to send us your message, how you have felt about this webinar. You can even actually put your feedback if you are fully satisfied and if you've really learned a lot from this webinar. Now, for this case, I'm going to invite Little Winnie to give us her conclusive remark about the soft skill training webinar tonight before we can close it.
All right. Thank you very much, Kamara, and everyone for attending. I must say that it's been a great honor sharing with you this very evening. I hope that you have been able to pick a word or two that you're able to go and reflect about. And then you can be able to think through on how you can be able to be a better employee, a better boss, and then you can be able to achieve your personal and also your professional goals. And I want to invite you on the 2nd of May. You know, May is actually a celebration of International Nurses and Midwives Day globally. I want to welcome you. We're actually going to be holding a physical soft skills training in healthcare at Popo Hotel. Registration is 50,000. Please, you can be able to reach out to Lilian Nuavine, and then you can be able to register with her or even Kamara Daniel. And then you can be a part of that celebration where we are going to still emphasize and talk more about soft skills. You're able to get your certificates at the end of the training. Please come and network. Please come and learn. Please come and be able to share and network and be a better person. And thank you very much to the Busoga Health Forum. It's been amazing connecting with the 109 participants this evening. And I hope that we can always be able to have these conversations ongoing. Thank you very much.
Thank you so much, Little Winnie Foundation. Just before you've concluded, but you have just one question. The question goes, does this soft skills training or entrepreneurship training go direct to the nurses and midwives only, or it is entailed all healthcare professionals?
It's open to everyone. As I say, that soft skills are actually open and can be practiced anywhere, whether in health or not even in health. Definitely, they can be able to come and join up. That is 2nd of May, 2024. Thank you.
Thank you so much, Little Winnie. I am also reminding the people or the members of the Busoga Health Forum that our annual general meeting is slated to take place on 30th of March 2024 at the Civil Service College starting at 9 a.m. If you're a member or any members, come and register and renew your subscriptions, come interact, share your expertise, and participate in this for a healthy, thriving Busoga. And also, I'm encouraging you, friends, that every Friday, 8 p.m., we'll have a webinar. I encourage you to always be part and learn more with us. Thank you so much for this. I am Kamara Daniel. I'm a nutritionist. I am a health presenter to Google Data Vision and a Community Hospital, Western Uganda, Kanungu District. I really thank you all, and back to you, Mr. Desmond.
Oh, thank you so much, Daniel, and thank you so much, Winnie Nabukera. This has been such a good session. And at this time, let me just invite the CEO of Busoga Health Forum to give closing remarks, but also award the certificates.
Yeah, thank you so much, Kamara, Mr. Kamara, and Win for managing this session. It's been interesting, and we are so impressed that we are able to learn from different stakeholders of this region. And we are happy to continue hosting you, and we appreciate all that you have done. And like Mr. Kamara said, we want to officially invite you all for our General Assembly. And we only remind you to renew your subscription so that we are able to facilitate the Busoga Health Forum activities. And when we call upon you, Busoga Health Forum is not only in videos, but also institutions. So the membership of the institution and the different people in your network is welcome, so that we continue building our Busoga and Uganda at large, because we are serving now the whole country and maybe people outside Uganda. So I would like to take the opportunity to thank you, and Winnie wants, on behalf of the Busoga Health Forum, to present you this certificate, and we appreciate it so much. Keep in touch with us. We shall always be getting back to you for more engagements. And Daniel Kamara, we are so humbled that you've spared time, and you have always been there for Busoga Health Forum. We want to keep this relationship continue, and we keep running business. God bless you so much.